So welcome to this CFCI seminar on the Heart and Lung Institute based on the Cambridge Biomedical Campus. For people who don't know me, I'm Peter Northmore. I'm a trustee of the CFCI. I'm also the treasurer of CFCI. On this call we have Brian Williams, who's the project sponsor for the University of Cambridge. We have Tom Fenner, who's the project manager for SDC. And we have George Rossi, who's the project manager for ACON. I'll just start off with a short introduction in the context of the scheme. And apologies, my voice is a bit croaky this afternoon, but hopefully it doesn't let me down too badly. As I say, we're here to talk through the Heart and Lung Institute, a new scheme being built at Papworth. Now it's being built adjacent to the Papworth Hospital site, which is the big blue building we all know, which I either love or hate, but there we are. So this is next door, in construction. Now the Royal Papworth is an interesting story. Papworth moved into Addenbrookes in 2019, previously out at the village of Papworth. It was housed in the old TV building out at Papworth. And I was involved some years ago around trying to rebuild the site at Papworth, and indeed trying to relocate the building at Papworth to another site. But about 10, 12 years ago, when the Cambridge Biomedical Campus was starting to be spoken about, Papworth made the decision to move across to Cambridge Biomedical Campus. 2 or 3 reasons for that. One was the co-location with Addenbrookes, the medical links that go with that, but also the research community, which they knew would come forward at the Cambridge Biomedical Campus, making it probably a world leader in terms of research. As we all know, Papworth is a specialist cardiothoracic hospital. It's a regional hospital for cardiothoracic services, and therefore research is important to the clinicians who keep their patients safe within the Papworth Hospital. This project is a collaboration between Royal Papworth and the University of Cambridge, and there's other users in the building, which Brian will also speak to this afternoon. That's just a very quick context from me. Brian, I'll hand to you for a bit more context and background on the university's building.
Sure, Peter. Yes, as Peter said, my name is Brian Williams. I'm the Major Projects Portfolio Leader at the University of Cambridge and Project Leader for the Heart and Lung Research Institute, also known as Project HRLI. This project creates a unique opportunity for the University of Cambridge and the Royal Papworth Hospital to form a clinical science partnership, combining the pioneering clinical excellence of Papworth with the leading edge research capability of the university. Professor Nick Morell is the director of the Institute. The importance of this partnership has taken on an even greater significance since the project began to move forward in the pre-pandemic world of 2014. Now, alongside other researchers within the building, the Wolfson Lung Injury Laboratory will house a team of 25 experts who will research long COVID, seeking new treatments for those suffering from the long-term impact of COVID-19. As one of the funding sources contributing to the 65 million total cost of the project, the university received a 30 million Research Partnership Investment Fund grant prior to commencing the project. Due to the reputational and financial risk of the university of not spending the grant on time, the contractor selection process clearly set out this requirement. I won't run through the whole team, but just to say Fairhurst Design Group were the client architects, achieving planning consent in 2016, and RHP Architects are part of the SDC team. Let's move on to Tom to hear about how the project is progressing.
Hello everyone. Thank you for your interest in our project. Without really knowing the formula for webinars of this type, to be honest, we didn't really know what a webinar was until we got invited before Christmas. We decided to produce a video which stitched together a little bit of detail about the project from our perspective, our being SDC builders, the main contractor for the scheme. So we produced a half an hour or so video, which combines input from my team and also from other project stakeholders, and we hope provides a nice summary about the building with lots of images and provides a good bit of context in these interesting and unusual times.
Tom, can I just remind people if they want to put any chat in, they could put the chat into the chat as we go and put your name on the chat as well, so we have the questions.
Project Atria represents a really exciting opportunity for SDC. We've worked over a number of projects with the University of Cambridge now and continue to build on our strong working relationship with them. On this particular project, we've also coupled that with working with Royal Papworth Hospital, and it's been a really exciting challenge and opportunity to work with both those critical players on this campus. The project was first tendered to us in April 2019. And SDC was successfully appointed in July 2019. The project started on site in January 2020 and with a planned completion date for February 2022. The project is a £45 million scheme for the University of Cambridge and in conjunction with Royal Papworth Hospital. It has a 10-bed clinical research facility on the ground floor with wet lab and write-up spaces associated with the upper floors. The ground floor also comprises a central concourse or atrium space, and also there is a research facility and teaching seminar spaces on the ground floor as well. The scheme, when it came to tender, it was clear from the documentation that we had to achieve the £30 million spend profile for the RPIF funding from the financial year April 2020 through to March 2021. And that became quite a key deliverable for us in the project. The project had been on the shelf for a couple of years because of the fact that the funding had not come through as previously planned by the university. And therefore we had to get the team back up to speed during the second stage in order that the project could go forwards at the speed it needed to expend the money. Another issue for the RPIF spending was the fact that the planning was due to run out on the project in November 2019, which was actually before our start date on site. So we had to come up with an enabling works package. We looked at various options and ran them concurrently through a cash flow forecasting exercise to see what works we could do in the pre-construction stage or the enabling works stage in order to speed up the funding spending profile when works actually started. What we were trying to do was hit the sweet spot, if you like, of getting the early phases of the project constructed, which don't necessarily hit the higher spending profile, but then making sure that those were done so that when we got into the critical part of the spend period, we were already at the higher valuation periods on the project. We're on target to achieve our RPIF spending profile, and we're one of the few projects in the country that has managed to do that, even despite all of the considerations that have happened with COVID-19 and the constraints that's put on the construction industry. Project Atria's energy strategy changed during the second stage of the project. Originally it was a CHP with gas, but it was clear that that was obviously older technology from when the project had its previous life. And one of the things that we had to do as part of our second stage assessment of the scheme was to look at what would be a more appropriate energy solution for the project. Obviously the university's guidance was heading more and more towards electrical rather than gas-fired systems. And so we developed a solution with air source heat pumps with a little bit of gas backup because there wasn't quite the electrical capacity in the system to be able to do it fully electric. But by doing that, we've achieved making it more energy efficient and helped with the BREEAM credentials of the project by going down that route. So another change that we made during the second stage was to change the concrete frame from a traditional RC frame into a PT structure, a post-tension structure. One of the key drivers for that was there were a number of downstand beams that were causing problems in the design. They were causing problems from a coordination point of view with the mechanical and electrical systems. And by changing the structure to post-tensioned, we managed to simplify that and make sure that all of the MEP systems could fit within the service zones that we had available. One of the things that was identified early on in the second stage was the lack of a service void between finished floor level and structural slab. We felt that that was really important to introduce into the scheme in order, especially in write-up areas where we wanted electrical distribution to be able to happen in the floor void. So we introduced 150mm raised access floor into the project in those areas to facilitate future adaptability for the scheme. So one of the key design features that the architect came up with on the project is a raking parapet that wraps around the building and is quite enigmatic of the scheme. We had problems in the second stage about how that was going to be achieved. And one of the things we decided to do was to cast a concrete upstand up to what we would consider normal parapet height to offer edge protection for the construction phase of the project, but then used a steel structure which is embedded into the concrete to be able to achieve some of the 3.5–4 meter high parapets that wrap around the building. One of the really important features of setting up a project like Atria is you need to have a team that is running right the way through the scheme, right the way from the beginning of the project when it comes into SDC, all the way through to the completion of the delivery. And that continuity of the staff is what makes the project a success for us. We have a project director, myself, that's involved in the scheme right the way through the project. And I was involved in the initial briefings from when we got the tender in, and I'll be involved right the way through to handover. We have 2 construction managers on this project, one that's specifically involved with dealing with the externals and another one that is involved on the internals. And that gives the project a focus and a drive so that not one element of the scheme takes priority over another, which we found really important. We have dedicated site engineers on the project, and their role is to assist the subcontractors rather than just checking their work. We have design managers. So the design managers start with the tender phase of the scheme and they work all the way through to the delivery of the project. And we find that that's really important to give continuity to the site managers so they understand the pressures and influences that have delivered a project and its design. The delivery of a project as complex as Project Atria, it's really important that you understand how you're going to deal with change. This project, because of the fact that it's a research-led building, obviously there's change that has to deal with the changing research that goes on within that facility. And so one of the things that we've always done is made sure that we keep good communication and dialogue with the end users and the representatives so that we can adapt and deal with any change as the project evolves and as the changing research evolves. That's something that we feel we've done really successfully on this project, so that we know that the building that we're going to deliver is the one that the client and the end users want to use. We have done that in various ways. We've put forward a separate team that are there as part of the briefing, and that has been director-led so that we can make sure that there's that continuity through the project that we talked about.
The Cambridge Heart and Lung Research Institute will draw together the clinical excellence of the Royal Papworth Hospital with some of the brightest scientific minds at the University of Cambridge to address the unmet need in these areas. To achieve our ambitious goals, this building is designed to maximise interdisciplinary science, leading from fundamental discoveries in genetics and population science through to laboratory science and ultimately to the bedside by testing new treatments in our purpose-built 10-bedded clinical research facility. We will work together with our strategic partners in the pharmaceutical industry and the vibrant biotechnology cluster in Cambridge to bring new treatments to patients with heart and lung disease. Another core function of the building is to attract and retain the most able scientists and to train the next generation of clinical scientists equipped with the skills to tackle the grand challenges that face us now and into the future.
The critical thing when setting up a construction site is sort of really reviewing the environment that you're moving into. We are in a very busy live biomedical campus environment, bolted onto a number of hospitals. We're nestled within the centre of the campus. We have had a relationship to sort of establish with AstraZeneca team, who have been running a very large project throughout our time on the site. We also needed to engage with the Papworth Hospital because they run such an important process over there, and it's absolutely critical that none of our operations hinder that, particularly considering how many challenges they've had over the past year. Definitely the biggest challenge that we faced at Project Atria was the fact that all of the primary services that supply Papworth Hospital actually cross the southern part of our site. All of our materials and personnel cross over those services every time they go to the building. Very early on we established a close relationship with Papworth Hospital to understand exactly what those services were, what the associated risks could be if they were damaged. We exposed all of those services using vacuum excavation technology and put in a concrete bridging structure over those services to protect them for all HGV crossings and material crossings over that space. Continually, we've designed our scheme so that it avoids interface with those services, and that concrete slab will remain part of the structure to protect those services forever. Another logistical challenge that we faced obviously is working in and around the Hobson's Conduit. The brook that you can see behind me now is a tributary to the Hobson's Conduit, a protected waterway that runs into Cambridge. Obviously our site operations immediately abutting that tributary had the potential to cause nuisance and concerns for that key waterway. And we put a lot of effort up front liaising with the trustees of the Hobson's Conduit and the Environment Agency to put our measures in place to protect it. One of the key things that we like to establish is trying to keep as many materials out of the building site as possible for as long as possible. So we've established a landside and airside of the site. And effectively what that means is that we have all of our material storage, all of our welfare arrangements and forklift movements on one side of the site, and materials only transport over to the site side within 24 hours of being installed. It means that we can keep materials within the site area to a minimum. Also means that materials aren't damaged in situ in readiness for being installed. We find it works quite well. We have a vehicle that transports materials from the land side to the air side, and all of our subcontractors are given a plot, and what that plot contains is a container and a tent, a storage tent, so that materials can be safely stored within their own control. They batch it up for us and we bring it to the workface, a bit like a material consolidation centre. So very early on, one of the key opportunities we found with this site was the potential to provide parking. The provision of parking, the importance of that cannot be understated. It's giving our site teams the capability to turn up to site in the morning and to offload their tools and materials and to get straight to the workface is a fantastic opportunity. And we work closely with the university to make available 100 parking spaces immediately adjacent to the site. This means that we get the best staff here who are the most efficient and get the most productivity out of their day. That's been very important for us, and there's obviously been the benefit throughout the pandemic of being able to offer car parking space and not requiring our site staff to utilise public transport, where you could argue the risk is higher than travelling in your own private car. There's absolutely no doubt that the arrival of COVID about approximately this time last year caused us as many challenges as you can imagine, and a lot of our effort and focus has been on really sort of adapting to the ever-evolving guidance. The government asked us to continue operating despite the pandemic, and we've had to be immensely adaptable. I'm so proud of everybody that's been a part of the project, particularly the SDC team and the subcontract staff that have been here day in, day out. I'm so pleased that we've been able to, fight our way through, immense challenges to get to a point where we're standing here today in line with our original programme aspirations, despite every challenge that we've faced. Delivering a normal building project is hard enough. There's all manner of unforeseen challenges that arise, and this has overshadowed them all, and we've been able to overcome that despite everything. I really do think that, not only SDC but the wider industry don't get the credit that we deserve for persisting despite all the challenges that we've faced. There have been times where challenges have arisen, where we've had to think on our feet, but with the investment and the support of SDC's senior team, coupled with the close liaison with the university and Papworth, who've been fantastic in assisting us with learning and providing guidance for our team, it's been a real learning experience. The government guidance has evolved continually, and we've had to adapt a lot. That's included an awful lot of financial investment to maintain operations. Obviously, stopping operations, especially on such a prestigious and critical building for such an important client to us, was not an option, and we've investigated every possible way to protect our staff. At no point have we had any concerns about the safety or well-being of our staff, but we've put every measure in place we can possibly think of to protect them, focusing initially on hygiene, personal segregation, and also ensuring that our site teams are segregated when they travel to and from the site, as we see that as a key risk point. As the guidance has evolved, we've put additional welfare facilities in. We've actually doubled our capabilities in terms of welfare and parking provision to maintain that segregation. We have 3 full-time cleaners on site who literally clean up behind everybody, and everybody has had a tiny little part to play in that process. One of the key measures that we've put in place has been the use of dual shifting. We have a shift that runs from 8 AM in the morning till 4 PM in the afternoon, and then that's predominantly mechanical and electrical site staff. That's circa 100 to 150 staff on a daily basis, and then at 4 o'clock we have what we call the builders work shift. So the supplementary trades such as the dry liners, ceiling fixers, floor layers, etc., they come in on the late shift, working from 4 PM to midnight. And a lot of our team have had to sacrifice and adjust their home life in order to implement that, and we as a company, and myself particularly, are very grateful for all of the sacrifice that the guys have put in order to maintain this programme. Obviously, the emergence of the pandemic has caused us to really reevaluate the way we work in many aspects, but one of the key things that we've noticed is that the mutual respect for each other's personal space has improved vastly. Obviously, with the hygiene and social distancing requirements, there are secondary benefits there about making sure that people give each other personal space in a site environment, and fundamentally a lot of accidents can be avoided by doing that. And I think there is a mutual respect between all of our site staff for what everybody's been through, and I'm immensely proud to be part of an organisation and an industry that has put measures in place at such a fast pace to protect them. The sequence of the scheme is obviously fundamental to the successful execution of the programme, the high quality, etc. Immediately when you came and visited this site before there was a building on it, it was quite a tight space. The building takes up a lot of the available space. Obviously we're very blessed with a nice logistical compound, but the building is tight. We initially looked at the scheme and thought about building the frame up in its entirety, bringing it up. That's certainly the most efficient way of doing it in terms of cost and programme with the superstructure. But actually, when we dissected it a little bit closer, it became evident that all of the challenging elements were in the west tower, which is the left-hand side as you look at it from this angle. The tower is bigger. It contains the clinical spaces, which require more in-depth focus and subcontract trades. It also contains the primary plant and equipment, whereas the secondary side of the east wing is a softer office space type environment, which is less heavily serviced and therefore requires less time on site. What we did was we structured our design and procurement process to ensure that the emphasis was always on the West Tower, and we built the West Tower up first in its entirety, got to the roof and immediately started cladding and dressing that wing whilst we were bringing up the East Tower, and this allowed us to put all of our efforts into the really critical side of the building where all of the most challenging elements of the scheme are. The progression of the East Tower allowed us to also bring up the central atrium spaces with it, culminating in the completion of the large transfer structures that sit on the top and are joined between the two wings. What we did do though, in order to optimise our weather-tight date, we constructed a temporary weather-tight wall on the inside line of the West Tower so that we could control the environment as early as possible, allowing us to perform activities, completion activities very early on. The construction manager Lee and the team also have implemented a heating system within the West Wing, and we've had the heating on since the start of December in the West Wing, which has allowed us to really get on with the finishing trades as soon as possible. And whilst it comes at a great expense, we do think it improves the quality and programme of our works.
The tunnel that connects Project Atria to Papworth is an in-situ concrete tunnel. To enable us to excavate for the tunnel, we had to install a secant wall. This helped retain the ground whilst we excavated, but also helped retain the groundwater that flows through the ground across the site. The design of the tunnel was in conjunction with Pudlow to help us produce a waterproof detail. This involved a membrane that covers the external tunnel, and the concrete used was modified to produce a waterproof concrete. The connection to the existing tunnel that comes out of the side of Papworth was a particular interesting and challenging detail. Due to limited access to the north of the site, we had to excavate the tunnel from both ends. This also helped with the construction process, so working from both ends helped us speed up our programme. This also exposed the existing tunnel at our earliest opportunity. This led to one of our main challenges, which is creating a movement joint between our tunnel and the existing tunnel, whilst having a stream flowing through the work area. We had to divert the stream and use pumps to remove the water, and also install bund walls within the existing tunnel to reduce the risk of flooding the existing tunnel if the pumps failed. The movement joint has produced the greatest of challenges dealing with the water pressure. We have overcome this using resin injection with additional membranes to provide a secondary means of water retention. The secant wall design enabled us to excavate without the use of internal props. The construction of the in-situ tunnel was unhindered. This helped us increase productivity and achieve the tunnel as programmed. The reason we chose the secant wall allowed us to reduce the disturbance to the hospital. We have vibration and noise monitors around the site so that we can monitor any impact on the hospital. Because of the nature of the beds, the rooms used at our end of the hospital are the most sensitive of patients.
The Atria facade consists of a vertical rain screen cladding system with punched windows, both of which are connected back to an SFS panelised system and a concrete frame. The cladding panels themselves are manufactured by a company named CGL, who are based up in Scotland, and as you can see behind me, they come in varying heights and 300mm widths, which allows a very impressive geometry of the building to be achieved. In terms of appearance, the panels themselves are anodised finish, and they're complemented very well by the windows which punch through the cladding, which come in a bronze polyester powder coated finish. The window units consist of a combination of glazed panels, opaque look-alike glazed panels, and decorated louvers and spandrel panels. Linking the east and west blocks of the building are two full-height glazed curtain walling elements, the north of which you can just about see sandwiched between the east and west wings behind me. In terms of challenges, with this building being such an elite and prestigious building, the facade has been rightly scrutinised from design all the way through to construction, and it's been demanded that it meets the very highest of standards. We've undertook a very thorough design process, which has not only involved the SDC team, our designers and our subcontractors, but also members of the client team and the local planning authority. And without doubt, all parties have contributed to the final end result that you can see behind me. A notable challenge was how we resolved the very intricate detailing between the cladding and the curtain walling packages. So let's have a look at the jam detail and see how we resolve this. To deliver the concept of having the bronze windows punch through the cladding, we have introduced three key components at this interface detail. The first is an L-shaped pressing that forms part of the curtain walling package, which then connects to a carefully folded aluminium flashing piece. This particular part was reviewed in great detail, and we've worked very closely with our manufacturer to maximise the folding capabilities of the 3mm aluminium sheet used to form this particular piece. This part then connects to the final piece, which consists of another L-shaped pressing that connects to the CGL cladding planks. All of these components are connected by carefully located discrete fixings, which you can see with the pink lines here on this diagram. All of these different components achieve what you can now see behind me, and as a team we're really happy with the results. However, I'd say the biggest challenge that us as a team have faced on this project in terms of facade has been the approach to managing tolerances. The design dictates that there's zero/no float when it comes to tolerances between the cladding and window interfaces, particularly where you have a window at first floor level with a window directly above at second floor level, which both need to be absolutely plumb because they're connected by a vertical cladding plank. We identified this very early on in the design stage, so therefore we followed through the mullions between the ground and first floor, or first and second floor windows, wherever we have a repetition. We follow those mullions through behind the cladding to guarantee plumbness. In addition to that, we've also appointed a dedicated full-time QA engineer whose sole responsibility on site is to go around and constantly monitor the setting out accuracy of the cladding and the curtain walling. Without a doubt, that's been a really worthwhile investment, because having the full-time engineer has allowed us to nip any issues in the bud, and it's allowed the facade packages to progress seamlessly on site. The purpose of the mock-up was twofold. Firstly, we were required to produce a mock-up as part of one of the planning conditions which came with the original planning consent. And secondly, given the different interfaces and intricate details associated with the facade, we thought it was really worthwhile doing a mock-up so that we could learn lessons from that and carry that through to the main building, because we certainly wouldn't want to be learning whilst doing the main building itself. In addition to the main mock-up, later off our own back we progressed a second mock-up. The purpose of this one was to home in on the detail where the cladding to the eastern side of the building overhangs the large seminar spaces. And by doing the mock-up, it allowed us to finalise the intricacies of the drip detail on the corner. Without doubt, that was absolutely worthwhile, because the mock-ups that you can see here on site have undergone at least 3 or 4 rounds of modifications to allow us to really home in on what the client wanted to achieve from the facade of their building.
From my perspective, the thing I enjoy most about construction is delivering high quality buildings for really nice people and people that we establish a rapport and long-standing relationship with. This job's been lovely because it's been working with a series of really important organisations to deliver a critically important building, and that's become all the more evident over the past year. I'm completely in awe of the people that I work alongside, who've come in, day out, despite all of the challenges, both at our head office and on our site and within our subcontractor body. And I think that just will make it all the more special when we walk over to the building for the final time with the client, and hopefully see the appreciation on their face.
Okay, well, thank you to Dan Changer, to Tom Fenner and the STC team for that presentation. Thank you very much. Just shows the complexity of the scheme we have here on the campus. If people can put any questions they've got into the chat room, we'll go through them. We've got about 10 minutes, quarter of an hour to answer a few questions. Our first one, could the panel confirm what sustainability energy saving measures are incorporated in the design is there a BREEAM rating? I haven't got a name for that one, but Tom, do you want to tackle that one?
Yeah. So as Dan alluded to in the presentation, originally, as the design was originally produced predominantly in 2016, one of the initial tasks we had to do was to really sort of bring it up to modern standards in terms of the university design guide, but also sort of building control. We changed the scheme from predominantly a gas-fired system to air source heat pumps on the roof with some gas-fired support due to the limited capacity that was already set in stone for the building. So KJ Tate worked very hard at a very early stage of our involvement to change quite a lot of the principles of the design. In terms of BREEAM, this BREEAM very good scheme with excellent ambitions for excellent in the energy criteria, which is a university-led ambition.
Okay, good. Thank you very much. Another question here. Who were the architects? Now I know there's more than one architect involved. Tom again.
Yeah, so the design, the original concept was created by Fairhurst Design Group at FDG from Manchester. They took the scheme to stage 3 and we picked it up with RH Partnership through to delivery phase.
I think it's important to add there, if I can, that the City Council planners were very determined to see a non-rectilinear building in this location, and were very clear that the bow of Papworth Hospital had to be addressed in the Heart and Lung Institute to ensure people were brought clearly into the buildings from both the circus and across the pond. So it was a challenge that Fairhurst met extremely well in the planning process.
So the challenges around the height, Brian, wasn't the height of the building couldn't be more than a certain height and the massing.
Indeed, yeah.
I've got another one just come in. What will the tunnel be used for? Brian, do you want to?
Yeah, so the tunnel is a patient transfer link with Papworth. So in the event of a fire dependent, volunteers might be taken through the tunnel into the facilities in Papworth, or indeed anyone in the clinical research facility taken unwell would be dealt with through the link with the crash team coming through the tunnel from Papworth. So it's mainly a clinical and patient transfer tunnel. It is not an FM tunnel in this instance.
Yeah. There's also staff transfers, clinician transfers as well, presumably. Okay, good. All right. Another one just come in. Yeah, when does the building go live in terms of the clients occupying the building? Brian, do you want to?
Or George, do you want to take that?
Or George, yeah, sorry, yeah, okay.
Yeah, so the building's due to be completed in February 22, and then there's a client occupation and fit out period, and the expectation is April 22 is when the building will start becoming operational.
Okay. And I heard it's on program at this stage?
It is, yeah, despite all the challenges with COVID, Brexit and everything else going on, so yep.
A lot of water in the ground as well. A lot of very high water table.
Yep.
What form of contract, or is that a bit too sensitive, Brian?
No, I think it's fair to say the university favour NEC3, and we've adopted that, I think, in a good partnership approach way with SDC, who are used to this form of contract, and that has supported the collaborative approach between contractor and client teams as we've moved forward.
Okay, good, thank you. I'll just come in. Is there an opportunity to get involved at this stage, joinery of the project? Or have these packages already been let? Well, I assume you've let them already, Tom.
Depends if you can undercut anyone else.
Yes.
That's already been let. Those packages have been let, unfortunately, but next time.
All right. In terms of ongoing maintenance, is there a soft landing commitment from SDC, a standard process, isn't it, university?
Do you want to answer that, Brian? Or?
No, you take it.
Yes, so really it's definitely one of the most critical deliverables, for the scheme, and we have a pre-existing relationship with the university, so it kind of helps. Yes, there's a 1 year maintenance commitment for planned preventive maintenance, and then the actual soft landings process is a 3-year process with continual learning and advice being given between parties following handover for 3 years.
If I could just add to that, the university has developed a project delivery manual, so all of these key processes, including soft landings, commissioning, and the whole range of issues around the project are covered through that.
Okay, good. Thank you very much. Another one just come in. Who's undertaking the external cladding package? It's impressive standard QA.
So the external cladding is just an interesting one, really, because the cladding, the origins of range screen cladding, quite often are in sort of industrial buildings, and so it's quite an important, subcontracted package to buy right. There's a plethora of options available. So on this scheme, because of the top quality coating, the obviously high expectations in terms of setting out of these small units, we went to the manufacturer, CGL Facades, who are owned by Merson, and asked them who are the top people for installing these schemes, and they recommended a company to us called Kovara Projects, Kovara, who are based in Surrey. We've really got on very well with them because they're familiar with the product, they know its capability and limitations. And so they were really good and quite robust with the architecture, which I hate to say is sometimes needed when defining, the capabilities of this system. I think we've struck the balance really well. Any requirements that any time they've stamped they put their foot down and said this can't be achieved, we've always been able to dissect the detail and find a different way of achieving it because of their extensive experience. So a company called Kovara, who we haven't used before, but were recommended to us by CGL.
Okay, good. Another one's come in. It's one for you, George, I think. Who was the PM and cost managers?
Yeah, so it's ACOM. So ACOM are delivering project management and cost management out of the Cambridge office.
Yeah.
And if I could just add to there, because of the nature of the program of this project, in the sense that it has moved forward between the REBA stages based on the availability of funding, and this unfortunately is the way that a number of university projects move forward, that is dependent on philanthropic and external funding. Our consultancy team have hung on in here with us, since the reinception of the program back in 2014. So it's been a long run for both project manager and cost manager team moving forward with the project, with various stand downs along the way.
Yeah. Okay, thank you, Brian. Another one, has the project gone through so much change since the beginning? Was there anything the design team would have done differently? Any lessons learned? Tom, do you want to try that one?
Yeah, I can't, as I've mentioned, our involvement started in 2019. So any sort of conceptual changes I'll need for others to comment on. In terms of what would we have done differently? I think quite possibly we would have looked at putting a raised access floor throughout the scheme rather than just the east wing. I think because of the nature of a research and development project, there's always evolving needs, both in laboratory and office areas, and we decided that it was more important to leave the raised access floor in the office areas, but kept the solid floor in the west. And I'm not saying we necessarily would have changed to a raised access floor, but that would have been something that would have been interesting to explore to optimise efficient flexibility in those spaces potentially. But yeah, I can't, probably more geared towards more conceptual changes, I guess, that question.
Yeah. As you said, Brian, you had to change as you went forward because time just elapsed in lots of areas.
Yeah, I think we were fairly solid with the brief for the planning consent, as I say, that was achieved in 2016. And the fundamental principles of the building in terms of both seminar space, the clinical research facility, the laboratories and open plan offices have remained the same. I think there's been some detailed changes as we've moved forward with the user engagements in terms of now 3 years on since the planning consent, starting to engage with the potential users of the building, and then moving that on again a couple of years, dealing with those people who are actually going to be moving into the building now. So those final tweaks of the building, the adjustments to C sheets as necessary, and final finessing of the interior design have been, the major changes at the end, I'd say.
Okay, good. All right, lovely. Not sure we have any more coming in on the chat, so give a few more minutes. If not, then we'll probably wind up. While I'm as a council member of CFCI, could I thank University Brian for allowing this to go forward. Also, I thank Papworth Hospital, Colin Glenn, who's the project manager for Papworth, and Andrew Selby, the director of estates, for their help. And SDC, your team, thank you, Tom, for putting this forward, and George also for contributing this afternoon. So I think that, yes, no more chats coming in, so I think we're probably exhausted there. So thank you very much to everybody and for those participating. And we'll see you at the next CFCI seminar. Okay.
Thank you.
Bye.